Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi, everyone. Welcome back to another episode of What Did the Patient Say with myself, Dr. Lauren Brindisi, and we are here with my patient, Debbie. I'm very excited to interview Debbie and have you guys hear all about the experiences that she has been through and the progress that she has made since coming into CFNC. So, Debbie, thank you so much for coming on.
Thank you.
So we'll just jump right into it. So why don't you tell our audience what kind of symptoms were you experiencing initially when all of your health challenges started?
Initially, my health challenges started back in about 2017. I was having problems with breathing. I would be walking, and I used to be able to walk 7-8 miles. Couldn't do as much. Found myself very breathless. With shorter distances, having to stop. Went to a pulmonologist in 2019. He said I had asthma, but he was very curt and, did not even really take any time with me. Then in 2021, I went back again to him because things were getting worse. I couldn't walk upstairs without getting breathless. I couldn't go up a ramp. Couldn't even take a shower without feeling like I was gasping for breath. And when I went back to him, the same pulmonologist, and he said, "Now you don't have asthma." So I was like, "Okay, what do I do now?" And he did not know, so he sent me on to a cardiologist to make sure that nothing was wrong with my heart. I had a heart catheterization done. I had, all sorts of cardiac workups done, and my heart's great. It wasn't until I actually went to a second pulmonologist with another system down here because I didn't like the demeanor of the first doctor, that he suggested that I look into places that deal with dysautonomia and kind of alternatives. He was an older gentleman, actually from Boston. And I just thought it was interesting because he actually listened to me, which you guys have done too, is he actually talked and then listened to my answers, and was able to put together, at least to a point, that something different is happening, and that I start looking.
Yeah, and that's huge. I'm so thankful that you were able to, get a second opinion and find a doctor who was willing to do that, because that's really how you found us, right? You started looking online, right? And
Yep.
And found us looking for a provider that treats dysautonomia.
Yes.
And so when was your initial appointment here?
I believe my first appointment it was just before Christmas. So it was really at the end of December. I had been last year, to all of these, or over the last couple of years, but last year was the cardiologist and the second pulmonologist. And that's when I started looking and searching, and I found a number of places, but nothing was that close, until I did a couple of searches and found you guys up in North Carolina, because there was in Jacksonville, and then there was Cleveland, and I'm like, I don't have that. I still work full time, and I wasn't going to have the time to take off large chunks of time to travel to some of these places. So that's when I made the decision and made the call to come there to your clinic.
Yeah. And so you came in, it was late December 2023.
Yes.
For anybody listening right now, we're in September of 2024. And we did our initial examination. And what we actually figured out was that Debbie was dealing with orthostatic hypotension. So this is a form of dysautonomia. Again, luckily this pulmonologist had, some understanding of what dysautonomia is. And while he maybe didn't know how to treat it, he knew that this was an avenue that was appropriate for you to look at. When people deal with dysautonomias, we see a lot of people in our office, and we do see a lot of tachycardia issues, but please understand that the autonomic nervous system controls and regulates a wide array of autonomic functions, and a lot of Debbie's were respiratory. And so we were able to see by testing her vitals, seated, lying, and standing, that her blood pressure was dropping quite significantly, like 30 to 40 points when she went from lying to standing. And you would feel, some dizziness and lightheadedness initially, but again, you were still very active. It wasn't like you were passing out every time you stood up. And so this was something that was mimicking a pulmonary issue. And really what we discovered was this was more of a neurological issue in the control and regulation of your blood pressure. And again, you already have been a very active person, and you still work and you're on the go. So being upright wasn't always super comfortable, but you were still able to go about your life. And so we really had to look with a fine-tooth comb to say, if we push these systems a little bit more, can we better understand what's happening, especially when you were going upstairs or you were trying to walk for long periods of time or exercise. And so then we started treatment, which was around February of 2024, so this year. And Debbie doesn't live in our backyard, so she does drive to us. She was driving to us for intensive days once a week for about 4 to 5 weeks. Debbie, tell us about your experience coming in to CFNC.
It was actually a great experience. One is getting to know what I have, to learn that there is a treatment for it too, after dealing with this, I said, since really 2017, and things progressively got worse. To have somebody be able to, figure out what it is. I mean, to me, I always like to know what's wrong, because you can't, if you put things off, things usually get worse. And that's what it was, even though I was trying to find answers. And coming in and dealing with your staff, and when the treatments were painless, really, and just really trying to get my autonomic system to fire the way it should be, as opposed to misfiring, I guess is the best way to put it. And yes, it was a travel, about an hour and a half to get there. I'm about an hour and a half south of you, but it was definitely well worth the travel. And I know you've had people come from a lot further. I also had to look at, because of course it wasn't covered with insurance. But to me, that became the latter part of it, that, if I wanted to get myself better, I needed to do something. I want to be able to enjoy life, and not just become a couch potato, which is kind of what I had been becoming, because I wasn't able to get any answers from anybody else.
Mm-hmm. And so now we're 7 months later. Again, Debbie was coming in, once a week for about 4 or 5 weeks. Then we went down to once a month for a few months, and we've just tapered you off of treatment here in the office. How are you feeling?
Oh, I feel much better. I have started walking. We've got a nice, since the weather's actually been turning nice. We have a bunch of river walks here around Columbia, and I've actually went and have been, Sunday mornings, I've been walking about 2 miles on it. And to me, that is huge. I mean, I started with not quite as much, at first, trying to get, but see, and it's less my breathing now than it is my joints, because I hadn't been exercising. So one of the things you wanted me to do was to start building up my stamina. So that's what I'm doing. I'm slowly, first the feet were bothering me a little bit more, and the hips. But as I'm getting more active again, those particular symptoms are going away, and I'm able to get a little further, which feels great because I couldn't walk, up a flight of stairs without, just being completely winded. And I knew at that point that, I had to look at something, and I did. And with the treatments that I've been able to get there at the clinic, it's night and day. I definitely have made a 180 in just my stamina now, being able to get back out. I want to back out and ride my bike. So I'm hoping to be able to do that soon, and walk a little further without feeling like I want to pass out. So those things are awesome.
Yeah, that's so huge. And I really want to applaud you for all of the work that you did to really take your health into your own hands and, make some tough decisions, right? I said to you right out the gate, I go, I don't have a magic pill to make this go away, but I've got tools and resources and education to help you get there. And I know that that's not easy, right? You had to drive, like you said, an hour and a half to and from. You had to take the day off of work, spend the whole day with us. Then I kept giving you more and more stuff to do at home, diet and supplements and exercise regimens and neurological rehab exercises. And we hooked you up with a hyperbaric chamber at your house. So there's a lot of work that goes into helping people heal and repair from these issues. But Debbie, I think you're really a testament to the progress that can be made. I mean, this has only been 7 months. And if you had to give us a percent, how much better would you say that you are overall since starting treatment?
Overall, I would say I'm probably at about 80 to 85%. Which again is, to me, is just a miracle from where I was and how disappointed I was getting after going from doctor to doctor in the Western medicine, and them literally saying we don't know. So I really got to a point where I had to take my health into my own hands, and try anything I could in order to. I have but doing the holistic way, doing things alternative, if some people call it that. To me, I think it's becoming more mainstream, to be able to do some of these other types of therapies, and I still have that hyperbaric chamber right now because I had another month free, but I will be sending that back actually next week. So I will get a room back. But it has made me feel, I mean, that really did help kind of, accelerate some of the things as well, was having that. But there are a couple of places nearby that do have them. Since I will be retiring in January, I'll have the opportunity to go during the day, more as needed. So
Yeah, that's exciting.
so
My last question for you is really, if you had one thing to tell somebody who's watching this, who really resonates with your issues, maybe has a diagnosis of orthostatic hypotension, what is something that you really learned along this process that you would want somebody else to know?
that there is a solution. I know it's not a cure. I know that there'll be things that I'll need to continue doing, I am sure, for the rest of my life, but I'm not stuck. So I mean, to me, it was a lifesaver, truly. Take control of your health and your healthcare, and just to do it. Really, just do it.
I think that's really well said.
Yeah, I get to do things now. And, as opposed to, oh my God, I feel like I have to do it, but I can't. And that whole thing is just, you're just different outlook on life now.
I love that so much. I mean, what you just said really resonates with me too. And I think at this point, again, it's September 2024. And, we just had presidential debates last night. And
Yep.
one of the big topics, of course, is always healthcare.
Yep.
And for you to say, not only take control of your health, but take control of your health care. It's just the reality of where we're at, right? Nobody's coming to save us. and we need to prioritize our health.
Yep.
And it's up to us to do it.
Yes, nobody's as much as some might think. Yeah, we have to be the, I had to take destiny, my own destiny, my life and my destiny into my own hands, and not just and do the research. And thank God we've got the internet and Google. We have these things to be able to look. Once I had a little nugget of information of a possibility, it opened up the possibilities for me. When just having one person listen a little longer, brought me to your clinic. And like I said, I'm night and day from where I was when I first contacted you guys and came there, 10 months ago. And I know that as I continue with some of the at-home therapies, I'll just continue to get better. And I can't ask for more than that.
Yeah. And that's, that's what we expect. So we expect for Debbie and the progress that she's made so far, that if she's compliant with the things we're recommending at home, and again, just like she said, a lot of the lifestyle changes that we have coached her on are things that are just better for people's health in general, honestly, at this point. And we're tapering her off some of the other treatments. Like she said, she's had a hyperbaric chamber for a little bit, and she's getting rid of that, but she's going to be walking and active more. And those are the things that once we've moved her to this place where she can do that without being symptomatic, her body should be able to continue to support her. And then we're always here. So
Yep.
She's moved to telehealth. A lot of we'll just check in maybe once in a while, and she'll call if she needs us. Also, we're not going anywhere, and we're always here for you if something else does happen. But she's made major progress, and we expect that to stay that way if she continues living a healthy lifestyle.
Yeah. And the other thing I had to do was, right, you have to do the homework. You guys got me started, but I had to put the work in, not just there in your office, but, wherever I am. And that is something too that, the people need to remember. It's kind of like physical therapy. It's fine if you just do it there, but you have to keep it up in order to continue to get better. And that's what I'm finding, that as I continue it, again, I'm getting better and better. And, I'm not sure what else I can say. I am grateful, for the help that I have been able to get, and to be able to find, somebody who could figure out what was actually wrong with me.
Yeah. Well, I'm glad that, we were able to cross paths and you were able to get the support that you need. I feel honored to be able to help you. And I'm so happy to hear that you're doing so well. Thank you so much for coming on and being willing to share your story with people. If you guys want to learn anything else about dysautonomia, we have tons of information on our website. We have all sorts of other patient interviews, social medias, where we talk all about dysautonomias at Dysautonomia Doctors on Instagram. So reach out to us if you have any questions. We're always here to help. Thanks, Debbie.
Thank you very much. Bye.